My name is Erika Siegel. I'm a naturopathic physician here at Nature Cures Clinic, and I grew up on the East Coast, grew up in New Jersey, and had a fairly traditional upbringing as far as health goes. My mom was fairly progressive, but the environment around me was very standard conventional. I was on the conventional road towards conventional medical school, and when I learned about naturopathic medicine, sort of in the final hour, it was an aha moment in my life, and I quickly changed gears, moved out to Portland, started naturopathic school, and that was, 4 years became 6, 6 became, living in Portland, and now I'm deeply rooted here. I got my doctorate in naturopathic medicine and my master's in Chinese medicine at NCNM, and together they feel like a really great blend of East and West, conventional and more traditional medicine. In my practice, I am a primary care physician, family doctor, so I get to see pretty much the whole gamut from coughs and colds, chronic disease, and anything that comes up in between. So people come to me with their general health concerns. I do specialize in a few things. I see a lot of people with gastrointestinal disorders, so whether it be IBS, constipation, indigestion, food allergies, that whole picture. I work with a lot of people with mental emotional conditions, anxiety, depression, and a lot of times I see that working into their other aspects of their health, like GI health. I've had the opportunity to work with a lot of women that are trying to get pregnant or optimize fertility or even plan for pregnancy, what we call preconception health care. So I do a lot of that, and I love that, and it's exciting to be able to see families through the beginning, trying to get pregnant, into pregnancy, and then I get to treat the kids on the other end. So that really is where I enjoy doing family medicine. Or I'll see someone, they'll send their spouse in, and then they're sending their parent or their kid, and really get the whole feeling of the family and get to put it all together. It's like a puzzle. So that's been exciting, and I do quite a bit of women's health. So I see a lot of women with PCOS, menstrual disorders, and even just annual exams, wellness visits. I may see a woman once a year come in for her annual exam, and just regular preventative medicine. One thing that's so important to me is nutrition. It's a foundation of our health, and as now I'm a parent of 2 little boys, it's even more important for me to try to teach my patients to feed their kids healthy foods. And I want the next generation of kids to be asking for kale and beets and seaweed instead of packaged food and Frosted Flakes or something like that. So that's a passion of mine, is to really encourage people to put the right food in their body, because that is going to affect every aspect of their health. So that's important to me, and I'm an educator as well, and it's just a passion of mine to get people on board with what they put into their body, because it's so important. Well, a visit with me usually is very thorough. I ask a lot of questions. I want to know why, sort of like a 3-year-old child. I'm always asking, well, why? I really want to understand what's at the core. So what are the obstacles to this individual's health? Why aren't they getting to that next level of their health, or why did their health shift so dramatically at some point in their life? So I ask a lot of questions. Our intake form is very thorough, and then I usually go off of that and continue to ask more questions. The beginning visits with me it's the investigation. So I may pull in lab work. I often do a lot of lab work, imaging if necessary, asking a lot of questions, getting someone to tell me about their diet and their lifestyle, their work experience, environmental exposures, their whole history. I want to hear their story. So the first visit or 2 is going to be a lot about the story. And then as we're putting that puzzle together, we start in with our treatment plan. And treatment may include herbs or minerals, supplementation, definitely nutritional counseling. I do a lot of acupuncture. Most of my patients get acupuncture. And that's such a wonderful treatment, getting someone to rest on the table and getting their body a chance to heal in the office, and then they have the continued benefits as they're out in their day. So that's what a visit with me would entail. I really consider myself like a cheerleader or a health coach. It's a dynamic process between my patient and myself. I want to have them engaged. I really prefer to work with people that are motivated, because this is hard work. It is not easy to get healthy. So they need to be engaged, they need to be motivated, and I will be there every step of the way with support and guidance and cheerleading, because it's important to me that they don't navigate this by themselves. So I'm very encouraging, and I'm very compassionate. I'm a mother of 2, and before that I'm a daughter of a very compassionate woman, and so it's been part of my whole life to be a healthcare provider in a way. So this is that final expression of it as a physician for for wonderful patients. I feel so honored to work with the people that I work with. They're tremendous and have taught me so much. And I feel so grateful to work in this amazing clinic that offers so much for our patients and for our community.